Obstetrical scanning tips. Legal disclaimer: information is for general and educational purposes only. Content is not nor intended to be a substitute for professional legal or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained and expressly disclaim liability for errors and omissions. Course objectives. At the conclusion of this session, participants will be able to verbalize what an obstetrical scan and the various techniques that can be used are. You'll be able to verbalize the benefits of obstetrical scan to the mother and the fetus, and you'll be able to verbalize common challenges in performing an obstetrics exam and different obstetrical scanning tips. This topic is important because obstetrical scanning tips are important to ensure the safe and effective use of ultrasound technology in pregnancy care. These tips can help improve the accuracy of ultrasound examinations, reduce potential risks to pregnant women and their unborn babies, and enhance the overall quality of prenatal care. This topic is important. By following the best practices and guidelines for obstetrical ultrasound, healthcare providers can better diagnose and manage pregnancy-related conditions, monitor fetal development, and promote positive outcomes for both mothers and babies. Additionally, providing clear and accurate information to pregnant women about the purpose and benefits of obstetrical ultrasound can help alleviate any concerns or misconceptions they may have and promote informed decision-making about their prenatal care. What is an obstetrical scan? Also known as obstetrical ultrasonography or prenatal ultrasound, it's a non-invasive medical procedure that uses sound waves to create real-time visual images of the developing embryo or fetus in the uterus or womb during pregnancy. A standard part of prenatal care, providing valuable information about the health of the mother, the timing and progress of the pregnancy, and the health and development of the embryo or fetus. It can be performed using two main approaches: transvaginal ultrasonography, where the ultrasound probe is inserted into the vagina, typically used for early pregnancy, typically the first trimester, and for later stages to look at cervical length, and also transabdominal sonography, where the probe is placed on the abdomen. The choice of approach depends on the gestational age and the specific clinical question. So as stated before, the first trimester transvaginal ultrasonography is primarily used to confirm the presence of a pregnancy, measure the gestational sac, the yolk sac, and the fetal pole, estimate the gestational age, and assess for fetal cardiac activity. In the second and third trimesters, transabdominal ultrasonography is more commonly used to assess fetal lie, viability, biometrics, and placental location. Obstetrical ultrasonography can help detect the baby's heartbeat and position, identify any pathology, and assess maternal and fetal well-being. It can also detect congenital malformations, multiple pregnancies, and growth abnormalities, allowing for appropriate medical intervention or counseling. Routine obstetrical ultrasound before 24 weeks gestation can significantly reduce the risk of adverse perinatal outcomes, although there is no difference in perinatal death or poor outcomes for infants. The accuracy of fetal sex discernment depends on gestational age, precision of sonographic machine, and expertise of the operator, and fetal posture. Benefits of obstetrical scan to the mother and the fetus. It allows for confirmation of pregnancy, can confirm if you are indeed pregnant, and the earliest that an embryo is usually visible with a heartbeat is at about 6 weeks gestation. Determining the gestational age. Ultrasound can estimate the gestational age of the baby by measuring the CRL, or the crown rump length, during the first trimester, which helps determine the due date. Can also assess for multiple pregnancies, showing if there's multiples, and confirming the number of fetuses a woman is expecting. Assessing for fetal well-being, can assess and document the heartbeat and movement during the first trimester. Ultrasound can also detect fetal abnormalities. Some are physical conditions and structural abnormalities in the fetus, allowing for appropriate medical intervention or counseling. Monitoring of fetal growth, ensuring that the baby is growing normally, especially in cases of multiple pregnancies or high-risk pregnancies. checking the placenta and the umbilical cord. Obstetrical ultrasounds can examine the position of the placenta, the vessels in the umbilical cord, and the amount of amniotic fluid, which are crucial for the baby's health. Gender determination is also available for if the patient wants to know what the sex of their baby or babies is. It's also a non-invasive and safe tool to visualize the pregnancy without any harm to the embryo or fetus. However, it's important to note that obstetrical ultrasound cannot identify all fetal abnormalities, and when there are clinical or laboratory suspicions for a possible abnormality, a pregnant woman may have to undergo non-radiologic testing such as blood testing or amniocentesis. Ultrasounds should be performed when medically necessary. So, common challenges when performing obstetrical scans. Distractions such as children and multiple people in the scan room can cause distractions, potentially leading to missing important findings during the scan. Staffing levels. Having inadequate staff levels can impact the ability to deliver the service safely or the care provided to women and pregnant people. This should be reported to ensure evidence at a regional or national level to support workforce discussions. Implementation of new techniques or requirements. So changes to working practices, such as the implementation of new techniques, additional requirements added to an existing scan, or offering additional scans should be fully costed and staffing levels agreed upon as part of the business case or proposal. Common challenges in performing obstetrical scans. Communication is key. Clear communication strategies are important to ensure the safety of women and pregnant people and their babies. Clinical expertise, education, leadership, and management are crucial in this regard. Training and competencies. Scaling up training and sustaining competencies in obstetrical ultrasound among health workers in low-resource settings is a challenge that needs to be addressed. Communication skills. Improving communication skills among sonographers with emphasis on how to communicate ultrasound findings during and after scanning to women is essential. Long waiting times for the ultrasound examination can be a challenge, as expressed by participants in a study. And risk to pregnant women. Obstetrical ultrasound may pose risks to pregnant women, namely diagnostic errors and possible biological effects. Obstetrical scanning tips. No special preparation is needed for obstetrical scans, but it is best to wear loose clothing that can easily be lifted or removed to expose the abdomen. For transvaginal ultrasound, the patient should be in the dorsal lithotomy position with an empty bladder if possible. A chaperone should be present in the room. Transvaginal ultrasound is primarily used in the first trimester, while transabdominal ultrasound is used throughout pregnancy. The choice of approach depends on the gestational age and the specific clinical question. To diagnose an intrauterine pregnancy, a yolk sac or a fetal pole must be seen within a gestational sac inside the uterus. The gestational sac can be seen as early as 4 to 5 weeks with transvaginal ultrasound and 6 weeks with transabdominal ultrasound. The yolk sac can be seen at 5 to 6 weeks and the fetal pole at 5.5 to 7 weeks. Obstetrical ultrasound is widely available, easy to use, and non-ionizing, making it the preferred imaging modality for monitoring pregnant women and their unborn babies. It has been used for nearly 4 decades without evidence of harm to the embryo or fetus. Standard diagnostic ultrasound has no known harmful effects on humans, but it should be performed only when medically indicated. Obstetrical ultrasound cannot identify all fetal abnormalities. When there are clinical or laboratory suspicions of a possible abnormality, a pregnant woman may have to undergo non-radiologic testing such as a blood test or amniocentesis. Follow-up exams are often the best way to see if treatment is working or if a problem needs attention. Distractions from children and multiple people in the room should be minimized during the scan to ensure accurate results. In conclusion, an obstetrical scan, also known as obstetrical ultrasonography or prenatal ultrasound, is a non-invasive medical procedure that uses sound waves to create real-time visual images of developing embryo or fetus in the uterus or womb during pregnancy. It is a standard part of prenatal care in many countries, providing valuable information about the health of the mother, the timing and progress of the pregnancy, and the health and development of the embryo or fetus. By following best practices and guidelines for obstetrical ultrasound, healthcare providers can better diagnose and manage pregnancy-related conditions, monitor fetal development, and promote positive outcomes for both mothers and babies. Providing clear and accurate information to pregnant women about the purpose and benefits of obstetrical ultrasound can help alleviate any concerns or misconceptions they may have and promote informed decision-making about their prenatal care.